Monday marks the first day of school, and with it comes questions regarding how we will coexist with the COVID-19 variant that has surfaced in our community. Last year, I said that opening schools would be easy. Keeping them open would be our challenge. Last year, we had low numbers of positive cases at our neighborhood schools. Less than 1% of our students and employees reported testing positive for COVID-19. My staff and I have been diligently monitoring COVID-19 cases on our campuses. Our summer school program was the largest ever, but we saw low numbers of positive cases in our schools, even though masks were optional. Our year-round school, Castle Hills Elementary, opened on July 19th, and cases were initially low. This data led me to believe that a personal choice for masks was sufficient. However, the more our community is impacted by a rise in positive cases, the more our schools are impacted too. The data we are seeing now is different than last year or even this summer. First, we are seeing an increase in cases among students and staff. At the beginning of each week, we post the case numbers of the previous week to our Critical Updates webpage and report them to state and local health officials. Second, we are noticing student-to-student spread. It was rare to have transmission inside of our schools last year. The vast majority of the cases we reported in our district were brought in from the outside. In fact, throughout the entire district, our data shows that less than 24 cases were spread inside the classroom. This year's data does not reveal the same trend. To date at Castle Hills, we have seen 18 confirmed student cases of COVID-19 and 4 staff cases. Also, our data shows 12 of those student cases were due to close contact at the school. In contrast, there were only 11 total reported cases at Castle Hills last year. At this point, the data is showing us that mitigation strategies are necessary. School staff will continue to promote hand hygiene, classroom sanitation, and social distancing when possible. But it has been clear recently that those strategies are not enough. Currently, there is a mask mandate in place due to the city and county being granted a temporary restraining order against Governor Abbott. But regardless of how that plays out in the courts moving forward, I strongly recommend that we all wear face masks to reduce transmission on campus. If spread continues, we may be forced to close schools. We will continue to track our own data and community data, as well as listen to our health services team and our medical community. We will also be monitoring the court proceedings of local orders and the impact on the governor's executive order. I recognize that there are special cases and instances where a child cannot wear a mask. If you believe your child needs a medical exemption, please access the link below to complete a form and we will work with you. If you have any questions, reach out to your campus nurse. Parents, we need your help. It is so important that you check your child in the morning for symptoms. If they display COVID-19 symptoms, please keep them at home. You will find a list of symptoms and self-screening expectations in our school safety plan on our Critical Updates webpage. We will continue to send home notification letters if your child is in the same classroom as someone who tests positive. We also have COVID-19 tests available on campuses. Parents must provide permission for children to receive a rapid test. Should children need to quarantine, we will have remote conferencing available to continue their learning. This allows students to complete schoolwork and not be counted absent. This community worked together to keep schools open last year. We were able to open our schools and keep them open because of your partnership and vigilance. By working together, I know we can do it again. We will continue to use data to make informed decisions to ensure our campuses remain open. Thank you for watching, and I hope that you have a great first day of school.